1966, it didn't have a lot of health facilities, but it had several hospitals. As you know, the country was governed from Mafeking, and there was what was called Director of Medical Services in Mafeking, who was in charge of all the medical services. And then there was a medical officer of health who was in charge of preventive services. Now, these are people who moved into the country when the capital moved. Now, at that time, the health services consisted of several hospitals. I can't say exactly how many there are, although I can list quite a few of them. There were hospitals belonging to government, like Athlone Hospital, like Lady Leashing. Athlone Hospital is in Lobatse. Lady Leashing Hospital in Gaborone, like Sekoma Memorial Hospital in Seruwe, Jubilee Hospital in Francistown, Mahalape Hospital, and then there were mission hospitals. Kanye Seventh-day Adventist Hospital, and then Ramotswa Bamalite Lutheran Hospital, and then there was a hospital in Maung run by the UCCSA. There was Scottish Livingston Hospital in Mulepolola. There was Deborah Retief Memorial Hospital in Muchudi. And there were smallish hospitals. I think there was a hospital in Madinare and a hospital in Safari, but those were rather small hospitals. Those were mission hospitals.
That means we had something in 1966 when we took our independence. It's not like we came, after independence we just had nothing. I can see that you mentioned different regions of this country, and that means someone Right. Now, which approaches were taken to establish a well-strengthened healthcare system that once had no healthcare infrastructure? Because I understand that before there were no hospitals. These ones were built as time went by. But what were measures that were put in place to establish, strengthen after independence?
Yeah, these hospitals, of course, that I've mentioned, acted as a sort of the beginning. But after independence, the country, as you know, was expanding in everything, and the health system was no exception. In the early 70s, after Botswana started getting some income from the mines, the government put together something that was called Accelerated Rural Development Program. And health was one of the major components of the Accelerated Rural Development Program. The government paper, I think, is government paper number 1 of 1972 and government paper number 2 of 1973. Now, what was being targeted was that all the communities, or at least the recognized villages, communities, they were targeted to have health facilities, water facilities, education, and other developments. And Botswana started expanding its healthcare system very much in those days. The main thing was to build as many clinics as possible, health posts as possible, and what we called reach out system for people who did not have either a clinic of a health system. Now, of course, the expansion also meant that there was some expansion in the clinical services. As the mines were opening, there were hospitals built in Orapa, a hospital built in Joneng, hospital in Selibe Pikwe as well. So all this came together, and then as time passed, the government had a system of deciding where to put clinics. In the first place, the local government system, the clinic, sorry about that, not clinics, but the district and town councils were given a role They were to run the health services that were what we would call primary level health services. That would be clinics and health posts and so on. Of course, the guiding principle or the steward of the whole health system was the Ministry of Health.
Right. I was about to ask that what determined the placement of these clinics? Was it the population or where a lot of people were concentrated?
Yes, I'll come to that. The placement of clinics and health posts and so on was determined by a combination of population and distance.
Right.
The population was not so set, but the distance, it was agreed that nobody should walk more than 8 kilometers to a health facility. As you know, Botswana has got a very sparse population. Most of the population, maybe 80 or so percent, is in the so-called Eastern Corridor, which basically means the villages and towns along the A1. It's called and then as you go west, the country is very big. 2/3 of the country is in the west, but very few people are in the west. So determining where to put a health facility, a clinic, a health post, was quite a challenge in the western villages, where you can go for miles upon miles and only come to a small little village and so on. So these were the challenges that had to be faced by those who were planning the health system. But this is the area where it was called, as I said, the Accelerated Rural Development Program, the Basic Health Systems approach. And then in 1978, with Alma Ata Declaration on Primary Health Care, the system shifted to primary health care. And the main difference was that while the basic health system was looking basically at, clinics, etc., primary health care took into account community involvement and took into account what we call intersectoral approach. In other words, there are other sectors that have an impact on health, what is now called social determinants of health. Was also taken into account. Community involvement, which meant that people have to take part in planning the health system and so on, and in contributing to their own health. And
Mr. Maganu, not that I have interrupted, there are a lot of things that I want us to address, but we have a short time. I would like us to just briefly give answers to the questions that I'll be asking. The World Health Organization last year hailed Botswana for its health approaches, particularly in attaining the universal health coverage. What sort of investment and support and health models were put to achieve this milestone? I believe we've been praised the way we've grown compared to other developed countries.
Yes, perhaps, let me put it this way. Botswana performed very well in the 1970s and 80s in basic health services and primary health care. And it was very highly praised, very highly. I mean, we spent a lot of time in places like Geneva to go and give the experience of Botswana. There was a slowdown after the 1980s or 1990s. I think people change as time goes. And another problem, of course, was the impact of HIV. HIV disrupted a lot of the health services. While Botswana achieved very good indicators of health, in other words, after the introduction of the basic health services and primary health care, things like maternal mortality, death of mothers, death of children under 5 mortality, infant mortality, and so on, they went down very much. I mean, we became one of the best indicators in the continent. But HIV came, as you know, in the mid-80s.
We'll get to the HIV, but during your tenure, I will get to the HIV after this one, but during your tenure, what specific health policies were introduced that you believe had the most significant impact on improving healthcare access?
In my tenure as PS, I was PS for 7 years, from 1990 to 1996. And during that period, the main thing was to build on what had been built over the last 2 decades, the 1970s, 1980s. So nothing much new was introduced, but we strengthened the systems. We strengthened the decentralization system, strengthened the health the health delivery system as delivered by the local authorities, introduced more decentralization, actually handed over quite a few of the supervision of the health system, like the district health teams were handed over to the local authorities to strengthen the decentralization system. Right. Of course, the building of facilities continued. Yeah, so that by a very short time, not very short time, but we had one of the best concentrations of health facilities in the continent. And also the percentage of government expenditure on health went up. Of course, the GDP went up generally, but the percentage of GDP spent on health also went up.
All right.
Quite considerably.
All right, we've got 5 minutes to wrap up our conversation, but we've got a lot that I want us to touch into. Just in these 5 minutes, you can, wrap it up. Can you maybe elaborate as how the Ministry of Health, strategized on HIV treatment, evolved during your time, and what insights can be applied to this one? I cut you short earlier when you were about to get into the HIV.
Yeah, the first HIV positive person was discovered in 1985. And the nature of HIV is such that you have a silent spread because it's got a long incubation period. When you get infected by HIV, you probably won't get sick for another 4, 5, 6 years. So it spreads quietly. So we discovered the first one in 1985, and then the impact was not immediately, for the reasons I've just said, visible. But by the mid-1990s, we declared Botswana as the worst country in terms of HIV prevalence in the world. We had a very high HIV. But by that time, there was no treatment for HIV. The Western countries, the manufacturers of drugs and so on, were still experimenting, so on. So treatment really got well established at the end of the 90s. And that is when Botswana took up the treatment in 2000. And by then, the impact of HIV on our health indicators was terrible. I mean, the mortality rates had gone up so much, the life expectancy had gone down from 60-something to about 40. There was, but after the introduction of the antiretroviral, of treatment for HIV, these things started improving again, and we are almost now back to normal and a bit better than we were at the beginning of HIV. All
right. If you've just joined us, remember that we're in conversation here right now with Dr. Edward Maganu, former permanent secretary in the Ministry of Health. We are exploring on how the Ministry of Health, or the health sector in this country, has evolved until right now since we took independence. Now, given the rise of the non-communicable diseases, what steps did the Ministry of Health take during your leadership to address their growing impact on the population?
Of the non-communicable
disease, yeah.
During my time, the big problem was communicable diseases. The biggest killers were tuberculosis, infections of the lungs and so on. Not that there were no non-communicable diseases. They're always there.
Yeah.
I mean, they are part of the human race. But the main killers were communicable diseases, TB, and then later on HIV, infections of the lungs, infections of the gastrointestinal tract, and so on. What happens normally is that countries, as we have noticed in the Western countries control communicable diseases because communicable diseases are controllable usually with antibiotics and so on. Once you control communicable diseases, non-communicable diseases automatically take over. It's a natural process. We call it demographic transition or epidemiological transition. You control communicable diseases, and then the non-communicable diseases take over. Because if you are not killed by communicable disease, TB, etc., you are going to be killed by, you are going to die. You are going to be killed by heart diseases. You are going to be killed by cancer, and so on.
Right.
What the impact?
Now,
what should be done is to make sure people don't die prematurely. That they don't get non-communicable diseases in early age. But eventually, of course, the non-communicable diseases become dominant.
All right. Unfortunately, we'll have to wrap up our conversation. We've got 60 seconds so that you can answer this question. That from your perspective, what are the ongoing challenges in ensuring the sustainability of Botswana's healthcare, and what measures do you think should be prioritized moving forward in just 60 seconds?
I think what should be prioritized is to better articulate the primary healthcare system. The primary healthcare system has changed over time, and of course the people running the health sector have also got their own concept of primary healthcare. And I think what the ministry is facing as a major challenge now is to articulate the primary healthcare system to take over from what was there in the past.
Right. Maganu, thank you so much. We have to go to the 7 o'clock news. We wanted to discuss a lot of things, but unfortunately, we've got no time. Thank you so much for your insights.
I'm at your service. Thank you, sir.
All right, and that is how we come to the end of this conversation. I'm coming right back with the 7 o'clock news.
Reflections on Botswana's 58th year independence pay homage to the great men and women who have contributed in small and big ways to a better Botswana. Their outstanding contribution and trailblazing impact across sectors of development have pioneered change. President Dr. Mokgweetsi Masisi will recognize these deserving pillars of Botswana community at a Presidential Honors Awards ceremony on the 29th September.
Over the past 5 years,